So, it comes under lots of different names. So vision therapy, vision training, orthoptics, neuro-optometric rehabilitation. So vision therapy, I like to say to my patients, is like physiotherapy for your visual system. You're being put in a situation where the activities are to highlight how you currently do things, and usually it means that we're highlighting how well you're not doing them, highlighting the dysfunction, and giving a controlled environment with someone who's coaching you in the right direction on how to learn how to get the two eyes working together better, learning how to focus, learning how to combine focusing with eye teaming and with tracking, and sometimes visual processing. So it's really building visual skill through eye exercises. Obviously, hopefully if you've been watching the channel enough, it's not about muscles, it's about the brain and the brain's ability to send the right signals and combine the information in the right way. And so we're just providing an environment where we go through these activities that give you feedback on when you're doing it well and when an opportunity to do it better if you're not doing it well. So we're setting up a system where you're actually making these little mistakes and you're practicing so that those mistakes become less and less, and you're building visual skill at the same time.
So a vision therapy program then would be something that people do at home, but then they come into your clinic periodically for follow-up visits and additional training, I guess. Is that right?
Yeah, look, we find the most successful form of vision therapy is one that has an office-based component, because you really need that skilled person giving you one-on-one feedback to how you're doing an activity and directing your attention in the right way. Sometimes if you've got a vision problem or some aspect of your vision's not working well, you feel the consequences of it, but you might not be aware of what is actually happening. And it's a bit like a physiotherapist or even a sports coach saying, hey, when you swing your racket that way, do you notice what happens to your left foot? When you do this particular visual activity, this is what we're noticing. Can you now do it a different way and pay attention to that? So having that one-on-one coaching is ideal. Now, we do that directly in the clinic. So people come in and have a one session per week with a vision therapist. We see people from all over the country and all over the world. So we've got some prolonged experience even before COVID of doing a telehealth version of that. So we still have their weekly session, but it's online as opposed to in person. And then the critical part is that they're also doing some home activities in between to kind of reinforce what they've been learning with the vision therapist. And then we didn't need to do it long enough to make those new skills something the brain wants to hang on to. So effectively, we want them to become a habit.